Hey guys, it's Leah B from Prestige Veteran Medical Consulting. I am a U.S. Army veteran, physician assistant, and former compensation and pension examiner. So today I want to come on and discuss Alzheimer's and how that can be related to tinnitus and VA disability. So off the bat, this is something that I don't think a lot of people would think of. And I was asked to review a case like this recently for a veteran who passed away of Alzheimer's by the surviving spouse and the attorney. Okay. And so at first I thought, this is sort of, a tough case. I'm not really sure that there's going to be a lot of evidence to support this. But in actuality, after I did a lot of research, there really was a significant amount of literature to support this type of connection. Now, not everybody is going to have this connection. It's based on the circumstances. And this veteran spouse did wind up going before a judge and after several years of appeals and was granted service connection for her deceased spouse for the DIC case. Okay. So if you're interested in more information about DIC cases, we've got a few videos, in the past that we've done on that as well. And you can take a look. But when it comes to this particular connection, veterans often face a range of health challenges as a result of their service, right? So the two conditions that frequently appear in this population are Alzheimer's disease and tinnitus, right? So we just don't think about pairing them together, but tinnitus is one of the most frequent disabilities that veterans are receiving service connection for, and many veterans also suffer from Alzheimer's disease. So while both conditions are well known on their own, research has suggested that there may be a connection between them, particularly in veterans. Alzheimer's is a degenerative brain disorder affecting memory and cognitive function, while tinnitus is characterized by persistent ringing or buzzing in the ears. For veterans, the stress of military service, exposure to loud noises, and other factors may increase the risk of developing both conditions. And understanding that overlap between them can become crucial for providing better care and treatment options for those affected, and also for seeking service-connected disability, right? So I'd like to pull up Mayo Clinic and discuss what Mayo Clinic describes Alzheimer's as, right? So Alzheimer's is a disease. It's the most common cause of dementia, and it is a disease. It's a biological process that begins with the appearance of buildup of proteins in the form of amyloid plaques and neurofibrillary tangles in the brain. This causes brain cells to die over time and the brain to shrink. About 6.9 million people in the US age 65 and older live with Alzheimer's disease. Among them, more than 70% are age 75 and older. Of the more than 55 million people in the world with dementia, 60 to 70% are estimated to have Alzheimer's disease. Early symptoms of Alzheimer's disease include forgetting recent events or conversations. Over time, Alzheimer's disease leads to serious memory loss and affects a person's ability to do everyday tasks. There's no cure for Alzheimer's, and in advanced stages, loss of brain function can cause dehydration, poor nutrition, or infection, and these complications can result in death. There are a lot of medications that can improve symptoms or slow the decline. And that's about it. They discuss a bunch of the symptoms, but we're really just going to talk about that overlap with tinnitus today. So I'd like to pull up some of the articles. Again, if you're a veteran suffering from Alzheimer's or your spouse is, there are many causes. So it's best to discuss this with your treating provider, especially because it can be so multifactorial. I just like to shine a light on this, especially for veterans that suffer from severe tinnitus or really bad hearing loss as well. It may be playing a role. So it's worth looking at the research and then also discussing it with your healthcare providers, right? So let me pull up some of that research that we have. All right. So first article, risk of early onset dementia among persons with tinnitus, a retrospective case control study published in Scientific Reports in 2021 reported that among a 2,616 sample size, the prevalence of prior tinnitus was 18%, 21.5% among cases, and 14.5% among controls. Their findings showed that pre-existing tinnitus was associated with a 68% increased risk of developing early onset dementia among young and middle-aged patients. The results call for greater awareness of tinnitus as a potential in the population. So an article entitled Beyond Hearing Loss, Does Tinnitus Cause Cognitive Impairment? Published in Clinical and Experimental Otolaryngology in February of 2020 further dives into the relationship between tinnitus and cognitive impairments. The author discussed a previous study that stated that in line with the findings of the authors of the other study, the study found that patients with severe tinnitus exhibited distinct cognitive deficits as evaluated using the cognitive ability screening instrument. Moreover, tinnitus severity showed a strong correlation with the extent of cognitive impairment. Another article, Cognitive Mechanisms in Chronic Tinnitus, Psychological Markers of a Failure to Switch Attention, published in 2016 in Frontiers in Psychology, is a good one to go over. I've got just a couple more we can talk about. Another study, Tinnitus, a Manifestation of Neurodegenerative Diseases, published in the International Bulletin of Otolaryngology in 2021, stated that a number of etiological factors can be involved in the genesis of tinnitus. One of them is hyperactivity of the auditory cortex. In addition, between the central cortex and the inner ear is increasingly thought to be related to oxidative damage caused by free radicals. It just goes on to say that tinnitus is an independent risk factor for subsequent neurodegenerative disease, and that further research is needed to confirm the conclusions of their research and investigate that pathophysiology and the relationship between tinnitus and Alzheimer's disease and tinnitus and Parkinson's disease. Another study titled Tinnitus and Risk of Alzheimer's and Parkinson's disease, a retrospective nationwide population-based cohort study published in Scientific Reports in 2020, stated that tinnitus has been implied as a soft sign of neurodegenerative disease, which is characterized by progressive loss of neuronal function, such as Alzheimer's disease and Parkinson's disease. And there's a lot more information in these articles. This one concluded that patients with tinnitus were 1.54 times more likely to develop Alzheimer's disease with a 95% confidence interval. And their results indicate an association between tinnitus and higher risk of developing both Alzheimer's and Parkinson's disease. So that's a lot of good research there. Again, it's multifactorial, so it's important to talk to your treating provider about this and to discuss, what their thoughts are on this as well. They might support you with a medical opinion. As always, if you have questions about the claims filing process, follow up with a VSO or another accredited legal professional like a claims agent or an attorney, and they should be able to give you some insight as well if they think this may be a case that they can assist you with or whatnot. So I hope this was helpful. Please drop some comments and let me know, if you have any thoughts on this, experiences, feedback. And as always, thank you for watching, and please like and subscribe. All right, see you guys later.